Hello, you're watching Offbeat Business TV or listening to the OBBM Network podcast. My name is Susan Hamilton, and I'm here today with Dr. Peter McCullough and John Leake, and we are going to talk a little bit more about health freedom and everything behind this very interesting book. We'll be right back. And we're back. Gentlemen, thank you so much for joining me to talk about this book. Health freedom is a big issue out there today. OBBM definitely stands for that, and you two have become speakers and authors to make sure we're all aware of it. I appreciate having so much dedicated and well-researched information come to the table.
Well, we have quite a story to tell, and I'm just so honored to team up with best-selling author, true crime author John Leake, right here in Dallas.
So true crime. So a true crime author, that sounds fun. Yes, is that something you do because of fun, or because you're enjoying the exposing the activity, or where do you come from?
Both. I like the mystery.
Yeah.
Both of my first books prior to writing this one had elements of mystery. I had to investigate myself, interview witnesses, analyze documents, and so forth. So I found the investigation a lot of fun.
Yeah.
Both of my first two true crime books had a strong forensic medical component. And for a while I lived in Vienna, Austria, and I actually was translating for a forensic doctor at the Vienna Institute of Forensic Medicine, which is a fabled old institution that was very decisive in developing a lot of forensic medical stuff that we now know today. And so I have a background of being interested in the medical side of the forensic investigation. So when COVID came in early 20, I was very alert to what seemed to me fraudulent misrepresentations of how this thing, what exactly we were dealing with.
Yeah.
And I pretty quickly realized that I should try and investigate and team up with someone with real medical authority. So I contacted Dr. McCullough.
Yes, the true medical authority on this. The courage to face COVID-19, preventing hospitalization and death while battling the biopharmaceutical complex. That's a mouthful.
That's a mouthful.
Biopharmaceutical complex, describe that.
Do you want to take a crack at it?
You know, as a practicing doctor, I saw from the beginning there were two bad outcomes from COVID-19, hospitalization and death. And what my patients told me said, "Doctor, listen, I understand this virus is in a sense like a tsunami, rolling over the country. It's going to hit here in Dallas. If I could just get through this at home and just not end up in the hospital, not lose my life, that would be a victory." It seemed like almost everyone was going to get SARS-CoV-2 infection, COVID-19. And as I began to embark, doing the best I could as a doctor, just like if we had a wave of another viral illness, let's say we had or a bacterial illness or protozoal illness, what if we had Legionnaires sweep through Dallas? I would do the best I could. Or any other type of respiratory illness, Zika virus, West Nile virus, we would do the best we could. And so as I was doing the best I could, using the drugs at hand available to me, working with others, as an academic doctor, I jumped into research, which is what I do, protocols, investigational drug applications, getting grants, organizing my research team, publishing, discussing findings. This is the lifeblood of scientific advancement. What I found is I ran up smack against the biopharmaceutical complex. I actually ran up against a formidable force that was working against the treatment of patients. It was working against my ability and my attempts to save lives.
Now, do you believe this was intentional?
I do now.
Yeah.
I do now, and I think John in his investigations has really exposed this.
Yeah, so I think when you examine what you suspect to be a crime, it's very useful to go back to the beginning and to walk through a timeline. So we tell this story in narrative form. You start with SARS-CoV-2 arriving, and the reader is taken into the point of view of Dr. McCullough and his colleagues. As first, they're scrambling to try and come up with a way of dealing with it. So, then it's old-fashioned, old-school doctoring. This is upon us. We've got to do something for patients. And then he has academic stature in publishing. So not only do we want to discover what could be useful in treating our patients, but what would be useful to the world of medicine. So he's scrambling to figure out how to confront the enemy, how to neutralize the enemy, and starts running into all of this strange resistance. And it wasn't just him. He discovered in his communications with other colleagues, and I jump around, they have the same experience.
That's everything that I heard here. I was doing interviews and listening to that and hearing that doctors couldn't do what they wanted to do to care for their patients, and they had this limited way of approaching this, and it just didn't seem like there were any good answers.
I've given a lot of thought to that particular point, and there was a sleight of hand trick that was performed in the media and in our federal health agencies. This likening a doctor in the year 2020 using FDA-approved repurposed drugs. They've been around for decades. They have huge safety profiles. Likening doctors doing that kind of doctoring, 21st century doctoring, to the old snake oil salesman of the West. And it's a very powerful deception, because all you have to do is say, McCullough and Harvey Risch at Yale and these guys, they're just snake oil salesmen. And that, it's almost like saying they're a conspiracy theorist. It just sort of flips a switch in the brain that is pejorative and dismissive. Well, that's not what they were doing at all.
Yeah.
And, well, anyway, I could go on. My perspective on this, to speak in a fairly blunt way, is this is a crime story. I mean, that was my interest. I mean, I think the medical, technical stuff is fascinating. But my interest in this is a crime, and it's not been adjudicated, and the Department of Justice should be investigating all of this.
You know, I very much believe that, and the fact that they're not makes me wonder how far they're in on all of that. I have a very big distrust now of the people that were deciding how things were going to be, because it certainly appears to me that we have enough evidence that something should happen, a different approach, some type of a, hey, I'm sorry, we got that wrong, we're responsible for a lot of death here because of this, and oh, by the way, my hand was in the money pot the whole time. It's criminal, all right.
Think about the complicity here.
Yeah.
Here in the Dallas area, what hospital is claiming to be a center of excellence? Where are the comparative data on how the hospitals are doing on COVID-19, length of stay, complications, mortality? What centers actually had outpatient treatment programs innovated with new protocols? The answer is none to any of those questions. And you go in any city in America. You know, I've asked the question, we look at our blue ribbon institutions, Mayo Clinic, Harvard, etc. Where is the Mayo approach to saving patients with COVID-19? Suddenly in healthcare, there's an absence of bravado. Americans should be asking the question, wait a minute, my grandmother's got COVID-19, what's the best hospital to go to? And I want to encourage our lawmakers, our business people, to start asking these questions.
Yes.
What has an institution or a practice group done for COVID-19? Show us your excellence in handling this awful illness. Now, fortunately, I think we're largely through it now. Most Americans have been touched by it. Sadly, a million Americans either died of it or with it, about 10 million hospitalizations. I've testified under oath now 3 times. And the cumulative impact that a fully employed early treatment program could have had as it evolved over time could have saved probably 2/3 of those lives, spared at least 2/3 of those hospitalizations. That's an enormous crime that was committed.
It was. So you're talking about the delivery of the protocol and the points of view we're getting. I mean, do you go into media? Do you go into, this idea that information that we need can be snuffed out, and that anybody who stands up again in opposition to a narrative is ridiculous.
Well, this was something that really surprised me because it's so evident, it's so out in the open. There were a series of what they called pandemic planning exercises or simulations.
Sure was.
There was one in Georgetown in January of 2000. Well, there have been a bunch,
Yeah.
but the most relevant ones are Georgetown in January of 17, right before Trump was sworn in. And then in October of 2019, right before SARS-CoV-2 actually arrived, there was a big pandemic planning exercise at Johns Hopkins. And what's interesting is, I mean, I'll just watch the videos.
That's right. That's right.
I mean, there is an absolute insistence this is coming, and in the case of the Johns Hopkins, it was a coronavirus outbreak, a SARS-like coronavirus outbreak. But with respect to the media, what I thought was so notable was there are media people who are on this mock pandemic response board who are saying the days of just a free, forum of information, exchange of free information are over. Social media in particular is going to have to get on board to specifically tell the science, which is anyone who's studied the history of science or medicine knows straight away that is preposterous. Science is a whole bunch of people looking at the world and comparing notes. It's not some college of cardinals who say this is science. And the other thing, if you just think about it for one moment, by their own assertion, this is novel. So how can you have an authoritative pronouncement about something that you don't know about? It just showed up. So all of this stuff is out in the open. It's in videos, it's in business plans. All you have to do is just apply some attention to it.
You certainly do. We'll be right back because we're not done. All right, so let's keep going. All right, so we've got crime here. Go ahead and share more of this book without giving too much of it away. What do you want us to know?
Well, I think that the reader will find it very satisfying and illuminating to, the foreign invader is upon us, and we see in real time, or walking through the timeline, how do Dr. McCullough and his colleagues respond to it? And I think if the reader walks through this in narrative form, with the beginning and a middle and an end, any reader will understand his line of thinking.
Yeah. Now, is it strictly your line of thinking, or are there other
No, there are
references?
multiple. I mean, I think of Dr. McCullough and these other characters in the book. It's like Henry V. We few, we happy few, we band of brothers. I mean, you've got Professor Raoul.
We're going to get back on the line.
In France, there's Harvey Risch at Yale. There's this guy Vladimir Zelenko.
You just keep it up. Hang on a second. Let's get back in.
Okay.
Yeah, let's keep. Are you ready?
Ready. Oh, I'm sorry. Do you want me to?
No, we're in right now.
Oh, okay.
And we're back. We're talking to Dr. Peter McCullough and author John Leake about the courage to face COVID-19 and the fact that this was actually a crime, and it's all exposed in this book. So I'm excited. I'll have the link for you in the description box on Offbeat Business TV on our Rumble channel. So if you're watching on Roku, make sure you subscribe to us on Rumble. The courage to face COVID-19, preventing hospitalization and death while battling the biopharmaceutical complex. And you're really outlining a crime here that it's got Dr. McCullough's personal, this is what happened to me narrative, but that's not the only one you drew from. You had several different...
Well, Dr. McCullough, he's constantly, as you walk through the timeline of this narrative, you will see from his point of view, he's looking for what other guys in the world are discovering. And so we're connecting all of these guys. And I think of them as like, Henry V's famous speech, we few, we happy few, we band of brothers. It's like this group of guys, they're scattered all over the world, and they're all trying to figure out, how do we deal with this public health emergency? And all of them, and just trying to help their patients and figure out what to do, they all start encountering this same strange resistance from their, I mean, there's this professor in Marseille, France, who's a big, interesting, flamboyant character in this book, Professor Didier Raoul, and he encounters the same resistance from the French health establishment in Paris that Dr. McCullough does in Dallas with respect to Washington. So all of these guys are having the exact same experience, which is almost eerie. It's almost like a Twilight Zone thing.
Yeah.
Like, why is there this directive coming down from on high telling all of these extremely experienced doctors what to do? It's just downright mysterious.
You know, there's some local points of interest and innovation. Part of the book describes a scene where our Bible study at church finally decided to regather after the lockdown. The very first Bible study, people started asking me, Dr. McCullough, what's it like? I said, well, I'm working on trying to figure out how to treat COVID. And somebody in my Bible study said, oh, there's a doctor who's already figured it out in Dallas. I said, really? Who? They said, Yvette Lozano. And so Yvette Lozano in her clinic over near White Rock, basically, she had already started to innovate separately from me without communication. I ultimately visited her clinic. I said, what are you doing? And this is what doctors should have been doing from the beginning. We should have been talking to each other. How are we figuring out how to treat it? So it should be reassuring to people of Dallas and of the country and of the world that doctors separately were figuring out how to treat COVID to prevent hospitalization and death, and that the concepts that we came up separately were very similar. The protocol's different, maybe the drug's a little bit different, but it took drugs organized to treat viral replication, inflammation, and blood clotting in a sequence delivered early to avoid hospitalization and death.
And there were so many of those different solutions and so many different combinations. And it was really eye-opening to watch Senator Ron Johnson's panel discussion and all of those things where it comes out. And it just seems to me that if legislators understand this, and it is a crime, what needs to happen, right? I mean, where's the accountability?
Well, I think there should be a full, exhaustive investigation of what went wrong. And Senator Johnson has done such a great job at the legislative level of opening this up with hearings of, let's try and figure out what's going on. But ultimately, I think there needs to be a referral to the Department of Justice.
That's kind of like, that's kind of like saying that any crime boss family should investigate themselves.
Right. Yeah.
I just don't know what to do about this. It seems like it's so big, and it's one of the reasons why I focus on local, because our strength is still here. We, the people, we still have some beautiful things with our Constitution where we can say nullification. That's a thing. You have a right to say that goes against constitutional protocols.
On that note, to me, what is so telling, what just tells the whole story is this. What we're describing, this true crime, this suppression of early therapy, it has gone absolutely hand in hand with general censorship.
Yeah.
We're seeing something now. There was just a note in the news today that Senator Elizabeth Warren has written a letter to Amazon saying you need to remove Robert F. Kennedy Jr.'s book from Amazon. And you think, well, is Senator Warren like a grand inquisitor? Is this the Holy Office of the Inquisition? Can she just have someone's work removed from the public forum? So, I'm sorry to be a little worked up about this, but I'm an author. our livelihood is based on the First Amendment of the U.S. Constitution. That's right. Senator Warren might familiarize herself with that document.
I don't much think they care about that document. They don't like it. They don't like it. When you look at all the different attacks, it was freedom of religion, freedom of the press, right? Where is our free press today? Today's we the people. We creating media that people can find and get information. So thank you so much for sharing your points of view and the things that you've learned. Because there's a lot of information out there, and not everybody has that kind of time to dig into it. And a lot of people don't realize you need to turn off your mainstream television, period. Right? It's all over. The amount of that censorship of great information. You couple that with then the indoctrination of these ideas and beliefs on such a massive scale, and you go, whoa, there's all kinds of pieces here to this crime. So describe a little bit more about some of the things you've seen.
I think that I mentioned earlier all of these verbal sleights of hand, like comparing medical guys like Dr. McCullough and Harvey Risch to this marvelous doctor out in the South Central California, George Fareed. I mean, these guys have been studying medicine for 50 years and clinical practices and formal studies in epidemiology. And you have this dismissive characterization of them in a New York Times op-ed, the snake oil salesman of the Senate. This is the most crude propaganda. And that was very eye-opening to me. I'm familiar with the history of propaganda.
Yes.
And it's usually very, very crude, inciting fear, inciting extremely a negative emotion, hostility, ridicule. Why on earth is this massive propaganda campaign being waged against treating patients with repurposed FDA-approved drugs?
So did you come to the conclusion?
Well, they work. I mean, that's the problem. Propaganda works, and the repurposed drugs work. So I know this sounds extremely sort of dastardly, but it is. The business plan of the biopharmaceutical complex, which is published, CEPI, the Center for Epidemic Preparedness Innovations, published their business plan in which they plainly assert another respiratory viral pandemic is coming, and when it comes, here is the solution. It's a 65-page business plan that does not mention a single word about treatment, not one. The entire business plan is a vaccine response. So treatment wasn't in the business plan.
In fact, treatment has been suppressed, all forms of treatment. One of the most highest quality, high-tech, effective treatments is monoclonal antibodies against SARS-CoV-2. From the beginning, there's been suppression of monoclonal antibodies. Where are they? They've been changed out multiple times. The virus has mutated multiple times, and yet the monoclonal antibodies are pulled off the market for theoretical concerns on lack of efficacy. The virus has mutated so much, the vaccines haven't been changed at all. They're still pushed full bore, but the monoclonal antibodies, no one can find them. Now, Pfizer and Merck have new entries of oral drugs that can be used. Virtually no mention of them. When people call Walgreens, all they hear, and CVS, all they hear is about the vaccines. There are no public programs integrating now these products. No forward-facing to America right now. A high-risk patient gets COVID-19. What should they do? We've even had Texas Senate hearings on this. And Senator Bob Hall proposed legislation that Texans should at least get some basic information about how to treat COVID-19. Do you know that was vigorously opposed by the Texas Medical Association, who wanted to replace information on treatment with a vaccine registry?
So if that smells to you, you're not wrong. We'll be right back. And we're back. We are having a riveting discussion with John Leake and Dr. Peter McCullough talking about The Courage to Face COVID-19, a very interesting research book that talks you all the way through a true crime story, and it's not a cold case.
Yeah, we wanted to establish in time, what do we know now? What can we really nail down now? But it's an ongoing story. It's going to take some time to work through it piece by piece. That we start with the crime of the suppression of early therapy, but in our second book we're going to talk about the mass vaccination, specifically the mandates.
Those who are, in a sense, committing crimes, it's all in the open. So, for example, a generic medication that doctors and patients have found useful in treating COVID-19 is ivermectin. The issues were just how to use it, the weight-based dosing, using it early, the duration, and we're now well over 70 studies, well over 35 randomized trials, and it clearly shows a signal of benefit and acceptable safety.
It seems like it was already on the United Nations list of approved medications they've been using internationally.
The drug itself has won a Nobel Prize. It's perfectly safe. And if doctors have found it useful, and if there is a signal of benefit in the literature without large definitive trials, which haven't been done, this idea is that we should, in my view as a clinician, use it, and people in my circles agree. The American Medical Association has an official campaign to, quote, abolish the use of ivermectin. So why would the American Medical Association want to abolish something that doctors have found useful and patients have found well tolerated? They officially want to abolish it.
The other thing that Dr. McCullough told me that I just thought was so bizarre, he pointed out to me that there's the causative agent, there's the virus that's circulating, but then there's the way the body reacts to it.
Yes.
And the body can have extreme overreactions causing inflammation, blood clotting. So it's not just attack the virus, that's your first line of defense. Once someone starts to get sick, the fire on the roof is, well, we have to treat the blood clotting or the pulmonary inflammation.
Yeah.
And that was such a surprise to me. There was this NIH guideline and this prohibition of using corticosteroids that had long been used for treating pulmonary inflammation.
The guidelines said specifically, do not treat COVID until someone comes into the hospital, and even then don't treat it until they need supplemental oxygen. We've never had guidelines for an infectious disease to allow somebody to get that sick before we start treatment. For every other form of pneumonia, we actually have time to first administration of antimicrobial. For staph infections, we start early. We avoid staphylococcal toxic shock syndrome. We avoid pneumococcal sepsis because we treat early in every case. In fact, a paper I was published with the Italians by Fazio and colleagues, the first 3 days are the golden window of treatment. Many of the concepts that the doctors figured out, we are already using in the hospital, but it was 2 weeks too late, is to advance them early. When I testified in the U.S. Senate, I held up my protocol. I said, how can this be controversial? We give corticosteroids for asthma, emphysema, allergic pneumonitis. How can this be controversial to give these medicines early when they have a chance to work?
Yeah, so bizarre what Dr. Bartlett went through trying to get budesonide into people. Right. What a terrible, terrible challenge. I mean, all the different levels of criminality come into play here. I wonder how, have either of you read that over 300-page document about how the Agenda 2030 is going to be rolled out? I mean, that's 8 years away from now. That's right. We're right here, and they're on target with these ideas. And it's like you said, it's documented. Everything that we need to know about this scenario is clearly documented. They've told you how they're going to do it. So coming to this conclusion, they're talking about ideally speaking, everyone sharing it, getting to a spot where everybody shares everything. But the world elites are not talking about sharing themselves. They're talking about us being in this, limiting the amount of people on the planet so that we can have this, we can stand sharing these resources here that are left, and we're going to call it joy. And I feel like all of these pieces are all together with that.
It's in part of virtual book burning.
Yeah.
What Elizabeth Warren is proposing is an electronic book burning of Robert F. Kennedy's book that doesn't agree with the official narrative, which is the official narrative is clearly directing and using false information. It's propaganda. It's actually a promotion of false information by those in position of authority. We're talking about complete and total censorship. It's already happened in the medical literature partially. It's already happened in the press. It's clearly in social media. You can see what's going on with Twitter and Elon Musk and who's in and who's out. There's been an announcement, President Biden has announced basically a truth commission and a truth czar. Who's going to decide truth or lack of truth? Listen, I'm a medical doctor. I'm one of the most published people in my field in the world in history. I am considered a medical authority. There is no one on earth who's going to determine for me what's true or not true about medical science. It's not going to happen.
what has happened? What do we do? What do we do with this gentleman?
Well, the other thing that was so stunning for me, I mean, for years we've heard about globalists and Davos man and this ambition to have a sort of unified world governance.
Oh, that's all on YouTube. You can find that. Anyone can find that.
Sure. So I thought, well, I wonder if this is being overstated, if maybe it's an oversimplification. But as I got into the research of this book, what I began to realize is that it's absolutely true.
Yeah.
And it shouldn't be. I mean, if you study history, what you realize is there are always these moments in history where you have a guy or a group of guys who aspires to a more expansive imperial governance. I mean, you think of the Roman Empire expanding throughout Europe and the Mediterranean and in North Africa. I mean, even the United States after the Second World War, we have military bases all over the planet Earth. So this is an aspiration that you see recurring throughout history. I think where we get confused is we think that it's going back again to the Romans, we imagine it to be primarily a military endeavor.
Yeah.
But what I think these globalists and Davos have discovered is that the military is actually obsolete and inefficient.
No, they can divide and conquer us through information, through separating us, and through fear. When you've got to divide and conquer, that is definitely what they want to do.
In a medical context,
Yeah.
the medical context brings the proximity to the individual, right? The information is part of it, but actually the Trojan horse for globalist control is through a medical crisis.
And the answer to that is local. The answer to that is being involved in your school boards, in your city councils, in your commissioner's court, because these monsters have a lot on their mind, and it's not hard to find. I'm excited to read this book and learn this perspective. We very much understand and concur. And you could go back to It's All on the Line, a documentary you'll find on Rumble and on OBBM Network TV, and see how we've drawn out how the United Nations has actually influenced the government right here in Dallas. I mean, it's not far away. It's right here in your backyard. And there comes a time when we have to make those decisions. What are we going to do about that? You know, when there's stories about the churches that knew full well they were carting people right past their church on their way to a concentration camp. And they didn't do anything. They didn't really understand that. And it got pretty soon the screams got louder and louder, and the churches sang louder and louder and played the pianos harder and harder. They didn't want to look because it's so evil. And now, so many years past that, we look at that and go, well, how could you not know? You're a mile away from this place. How could you not know? Well, we did know. We did know. And if you, as you said, history does repeat itself, and we have to pay attention to that. When you get rid of history, that's exactly how that happens. So it's time to start paying attention to who you're voting into office right here in your local space. Protect your area, pray, and this is actually good news, because darkness can't thrive when light shines on it. There's no such thing. So the fact that this came to the surface and we have an opportunity to talk about it, that tells us there's something we can still do about it. You're still breathing. And it's time to do something, because the entire world is waiting for the United States to do something about this and stand up for ourselves. Gentlemen, I appreciate you so much. What do you want the audience to know before we sign off today? How to reach you, and in particular, some of the things that you're doing right now that we can get behind you on.
Well, you can follow me on Twitter and all the major social media. Twitter's P_McCullough MD. The rest of social media is Peter McCullough MD. Welcome all the communication and feedback we possibly can. I have a weekly report I issue to the country on America Out Loud Talk Radio, the McCullough Report. And John's done a terrific job in the book promotion, and you can tell us more.
We have a website for the book, couragetofacecovid.com, couragetofacecovid.com, that gives some basic information about the two of us and the book, and a link to how you purchase the book. So I'd encourage people to spread that link around. It would be helpful to us.
That's right. Knowledge is power, folks. Remember, you're going to find all those links in the description box below on our Rumble channel. And you can find all of these programs on OBBM Network TV on your Roku. And we're all on Telegram, I believe. John, are you on Telegram as well?
Yeah.
So you'll be able to find our channels and find Dr. McCullough on Telegram as well. So until next time, hey, I'd love to hear your comments. So jump on Rumble and leave your comments below and let us know what you need to know. What are your questions? What did we leave you hanging with? And we will make sure we're answering those questions in future episodes. Thank you so much.